Hey, Dr. Tracy, board certified general pediatrician, and this is part 2 of ADHD basics for children. So in the first video, we talked about what exactly is ADHD and what are some things you can do behaviorally and structurally to help your child. First and foremost, it's about understanding them, and then it's about how do you create an environment around them that helps them develop those critical skills that they need as they get older. So the second thing to talk about is what are some other things that you can do as a caregiver of someone who has ADHD. The first thing I will say is if you have it yourself, get some help for yourself. ADHD is very genetic. It is passed down from parent to child, and it can be varying degrees depending on which lineage it comes from. And so if you manage your own ADHD symptoms, it really does help your child. There was a really cool book it's not scientifically based, but it really does make sense. It was written by someone who has ADHD, and he talked about one of the things that he felt made the most successful children of people who have ADHD is having one person in their life who has ADHD who understands them and another person in their life that doesn't have ADHD that gives them the high level of expectation. So if you do have ADHD yourself, get some help, get some resources, make sure you're managing yourself as much as you can. That will help your child. The next thing is to focus on those basics of life again. So if your brain is already really chaotic and things are moving around really quickly, what are some things you can do? Really good nutrition, first and foremost. And I'm not talking about expense here. I'm not talking about managing your gut health and all these things. I'm talking about just good basic nutrition. That can be frozen vegetables, that can be whatever is in your family's budget, but just thinking of how can you get as many fruits, vegetables, grains, proteins, fats, healthy food as possible, minimal processed food. Processed food definitely kind of drives up our blood sugar, drops it down pretty quickly. It can also be more addictive, so the kid tends to overeat it, and it doesn't give them great lasting energy, and they really need really lasting energy when they're already struggling to focus. Another thing is to focus on their sleep. Sleep should be a mainstay of treatment for ADHD. They need quite a bit of sleep compared to the average person, and most of them don't get enough. So make sure you have a really good bedtime routine. Make sure that it's very consistent. Make sure that you yourself are helping them wind down in the evening, that you're not allowing the kid to kind of run full bore and then expecting them to go to sleep. It's not going to happen. Have healthy sleep habits yourself. Set your kids up for success with sleep. If you need help, talk to your pediatrician. I would rather treat sleep than go straight to treating ADHD. So if you need more medical help with sleep, definitely talk to your pediatrician. So focusing on nutrition, sleep, physical exercise. Children with ADHD need to be very physically active. It doesn't always have to be organized sports. It can just be things as a family, taking a bike ride after dinner, making sure that you move their body as much as possible. Try to be a really active family and teach them that early on. It makes a huge difference in their focus and attention, getting out some of their hyperactivity if they're hyperactive, and it helps them learn to manage their symptoms as they get older. So those are 3 big things you can do right away. I have to continue to emphasize how important they are. So often, those things alone can make such a big difference that the child does not need any other further medical treatment. So focusing on those things, your own mental health, sleep, nutrition, and exercise. There are some supplements that you can take that have some benefit. The evidence-based medicine is kind of like, well, sometimes, but it doesn't hurt anything. So taking extra omega fatty acids or DHA definitely can help support brain development. There are some studies that have shown that people with ADHD might be lacking the ability to process those fats normally, and so giving them extra can be helpful. Magnesium supplements, specifically magnesium glycinate, can also be shown to be slightly calming for all people, but especially those with ADHD. And a few studies did show that people might actually be slightly deficient in magnesium, and that can contribute to more ADHD symptoms. It can also make them a little bit tired, so it's a good nutritional supplement to give in the evening to support healthy sleep. So hopefully these are some basics things that you can do as a parent or caregiver to really support your child, whether they have the diagnosis of ADHD or not, but specifically if they have the diagnosis, this is some of the very first things that you do. The next step that you want to take is behavioral therapy. Every study shows at least 6 months of behavioral therapy after the diagnosis of ADHD can be extremely helpful in the further treatment of that child. And so that involves helping the child understand their own symptoms as well as the family, supporting them. And so I cannot recommend this enough. If your pediatrician recommends this, they're not blowing you off. They know that this is better in the long run for your child than jumping straight to medication. Medication can absolutely be necessary with ADHD, and we'll do that in part 3. But I wanted to talk about the basics because often families want to jump straight to the medication and it's going to mess things up long term. And so starting with the basics of how to help your child can set everyone up for success and potentially minimize the use of medication when it's not absolutely necessary. So take care, ask some questions if you have them, and we'll do part 3. Bye.